Hello, everybody. This is Sarah Lucas from the William and Flora Hewlett Foundation in the U.S. We are going to get started with our webinar this morning. Welcome, welcome. This webinar is the 13th in a series of webinars hosted by the UN Statistical Division as part of the run-up to the UN World Data Forum. And the forum, as many of you know, aims to foster cooperation and open dialogue among governments, academia, international organizations, private sector, civil society, with a big focus on data being used to help advance the SDGs. Our topic for today is use versus protection, data in the balance during COVID-19. So we are up for an exciting and full discussion today, but before we dive in, I want to walk through a few housekeeping notes, please. The first is the obvious one we're all used to these days. Please remain on mute unless you are a designated speaker. We will be using the chat function to communicate during the webinar, and thank you for some of you who have already started doing that. The second housekeeping question is we will have plenty of time for questions at the end. Some of the questions that you've already sent in have shaped the conversation that we'll have today, and then there will be an opportunity for you to put questions in the chat function. You can send a chat directly to the host, and that person will help compile questions for the second half of the webinar. Finally, I would like to get a sense of who is in the virtual room. So thank you to those of you already from Mexico, Bangladesh, and Palestine to let us know where and who you are. May I invite you all now to find the chat function. If you just hover your mouse, you'll see some icons appear at the bottom. The blue one that looks like a speech bubble is the chat function. So just open that up and just offer us 2 words if you don't mind. The one word is the country where you are. And the second word is the sector you represent. Maybe you are from a national statistical office or the private sector, an international organization, or an NGO. Thank you. People are already getting started. Great. We've got Portugal, Australia, Brazil, US, UK, Norway. Wow, this is so exciting. All right. Well, as those start to roll in, I'd like to start by highlighting a few points that I think are very relevant for today's conversation. We are all living together through the COVID-19 crisis and response, and there's 3 characteristics of that response that I think are really relevant to today's conversation. The first is that this is an all hands on deck situation. No one government agency or even non-governmental actor can work alone in the response to COVID-19. National statistical offices are an important part of that response, and you cannot work alone in this crisis. This, of course, has been the case for the long time. NSOs are all accustomed to working closely with other governments and non-government partners, but this crisis makes that collaboration all the more urgent. The second characteristic is that there's just fast decision-making happening under uncertainty. Governments are making or need to make really quick decisions, not just about the public health response, but about fiscal policy, social safety nets, agriculture and food security, and more. And they need data for all of these decisions, and they need it now. And if they don't have the data when they need it, they'll make decisions without it. So the issue of timeliness is really critical. The third characteristic is that tensions between data use and data protection are not new, but they are more acute than ever in the context of this crisis. Data about people is at the center of the coronavirus response in every country, whether it's administrative data for health facilities, real-time behavioral and mobility data, contact tracing. It's all really highly sensitive personal information being used in fairly unprecedented ways. So uses of data that might have seemed invasive in a quote-unquote normal context could potentially be justified during a crisis, but we really can't use the crisis as an excuse to threaten privacy where it isn't necessary, or to lock in more invasive data uses that are justified during crisis but are not in normal times. So these characteristics came through loud and clear at the last webinar, the 12th webinar hosted by the UN World Data Forum. And that one focused on how new sources of data and new analytical models that are useful, that can be useful during the part of the COVID-19 response. And a few points came out very clearly in that webinar that we will build on today. The first is really related to this point about rapid decision making, that data has to be timely to be useful. And related to that, the second point that emerged was that disaggregated data is essential for understanding the differentiated effects of the pandemic across age, gender, ethnicity, levels of ability, things of that nature. The third point was that non-traditional data sources are an important complement to traditional data in fighting the pandemic, particularly where it comes to timeliness, mobility, and behavior data, and of course the gaps that are being caused by the fact that with social distancing, just fewer surveys can be carried out. And the fourth one, which I really hope is at the center of our conversation today, is that public dialogue about how data are used is critical for not only pressure testing the models that are proliferating right now, but also so that there's transparency about how data are used. And this public dialogue about data use applies equally to how governments are using data and how private firms are using data. So let me just pause here. You all are stepping up beautifully to share where you are from and what sector you are from. If you're just joining, please take a minute to go to the chat and just give us 2 words, the country and the sector that you represent today. So our topic for today is about balancing the imperatives of data use and data protection in the context of COVID-19. And I want to emphasize this notion of balance rather than versus, as the title of the webinar suggests. In fact, adequate data protection can enable and expand data use. So I think we'll have a conversation today really about this balancing and kind of complementarity of the imperatives of data use and data protection. All right, so let's start diving into some substance. I will argue that there are at least 5 levels at which we could consider balancing data use and data protection, 5 levels of discussion and action. The first is really around policy and regulatory frameworks. So some countries, of course, have policies in place explicitly designed for this purpose. The European General Data Protection or the regulation or the GDPR is the governing framework in Europe and has become a point of reference for many countries. And what we're seeing in Europe is that some countries are really able to generate the insights and the data that they need for the COVID response within the regulations parameters. And other countries are tapping into the emergency powers that the GDPR allows for analysis and processing of sensitive personal data, as long as those measures are proportionate and reversible. So the GDPR is guiding data use in the context of countries where it applies. However, there's a lot of countries in the world where these guidelines don't exist or they're weak. And for example, in Africa, 32 African countries have data protection laws on the books, and at least 5 more have them underway. But very few of them have the authorities and structures in place to implement and enforce these laws yet. And so this creates, in some African countries and elsewhere in the world, a more fragile policy environment that both makes it harder to innovate with data because the rules of the road aren't clear, and it increases the risk of overreach and invasive uses of data in the context of a global emergency. The second level of action or consideration is legal agreements. So any collaboration among actors, particularly when private sector data holders are involved, are generally formalized by legal agreements and data licensing agreements that are designed to direct how data are accessed, shared, and used. A third level is in partnership models. So how you structure a partnership model, whether you're working with a trusted third party who's doing your data analysis or data trusts or data pools, these partnership models can structure and inform how the balance between use and protection is struck. A fourth level is straight up technology. So there are ways within the technological and analytical models that can be privacy preserving. I'm sure we'll hear about those today. And finally, I want to highlight the notion of oversight. So some countries, such as Belgium, for example, are establishing ethics committees to guide their use of data during the COVID-19 response. These committees could include non-governmental actors that have expertise in epidemiology, philosophy, public health, law, ethics, and so on. And they would ideally be participating in an open, transparent process to inform how governments use data, and really importantly, will also inform how private sector uses data, but really importantly, help plan for how to roll back any kind of excessive uses of data or breaches of privacy that might have been justified during the crisis but aren't later. So I'm hoping that our conversation will touch on all of these levels. We've got 4 speakers today to help us do that. They'll each have about 7 minutes to talk through their own work, what data they're using and how in the COVID response, what worries or concerns they have about data privacy and protection, and hopefully some initial thoughts about this balancing act. But before we turn it over to our first speaker, let's get a look at who is in the room. Wow, this is an impressive lineup of people from, I see Kenya, Wales, Chile, Switzerland, India, Germany, Ireland, Philippines. You guys, it's so exciting to see people from Tanzania, Indonesia, Iran, Belarus. And many of you are from statistical offices, but I see a lot of civil society organizations here, which is wonderful. And I see UN agencies, private sector represented. We are bound to have a fantastic conversation. So all of you from around the world, please do send in your questions as you have them to our host, and we will get rolling. So we're going to kick it off first with Yusuf Murangwa, who is the Director General of the National Institute of Statistics of Rwanda. So Yusuf, please, over to you on these important issues of data use and data balance in the context of COVID-19.
Sarah, can you hear me? Hello, can you hear me, Sarah?
Yeah, we hear you, Yusuf.
Oh, thank you very much. First of all, thank you very much for organizing this meeting. It's very important, and especially it's very timely. In Rwanda, the National Institute of Statistics is part of other institutions that are supporting the COVID-19 mitigation efforts by providing data. But we are also a regulator in terms of data access, privacy, and confidentiality, working with other regulators in the country. So our role is very important in terms of providing data and access to data and use of data. In our job, for us to be able to contribute to the debate and the challenge of use versus privacy and confidentiality, we always examine 2 things that inform our approach. To start with, next slide, please. To start with, we try to understand the context that we are working in. Then we also try to understand who wants what and why do they want the information. And then that informs the approach that we take going forward in terms of both access, but also making sure that we protect confidentiality and privacy. Next slide, please. Regarding the context, one of the quick questions that we ask ourselves, especially in such a time, is of course, there is a lot of demand for access to data, and we have a lot of concerns vis-a-vis confidentiality and privacy. So we ask ourselves, is this a new challenge or it's an existing challenge? And we also ask ourselves, is it a stable thing? Is the challenge increasing? And honestly, I think the challenge between data use and protection and confidentiality has always been there, and it's increasing, and it will only increase further with time. COVID-19 is just one example that is showing us that we need to do something about it seriously. Of course, before COVID-19, when the SDGs were being adopted, we thought we'll need a lot of data and quickly. But now COVID-19 shows that we even need data even more quickly than what we thought during SDGs adoption. So this is a problem or a challenge that is just going to increase with time. And two, we ask ourselves what data is involved. For example, in Rwanda, some data would not have a problem. For example, economic data that shows a company and what the company does in terms of industry. And in this case, like in COVID-19, whether a company has a challenge, for example, many companies already publish their financial statements and so on and so forth. So for example, companies that are in a particular sector and they are struggling because of COVID-19, for example, the airline industry. In Rwanda, we have only one company in the airline industry. And by the time we talk about the airline industry, of course, we know the company by name and everything. So that kind of information is not a problem. So it's very easy to share. But for example, information that goes into the details of the workings of that company to the extent that it may compromise their interests, economic or otherwise, social information, for example, in Rwanda, especially with COVID-19, we want many institutions, especially those that are concerned with social welfare and welfare support. Sometimes they need information to the detail of the specific person that needs support. So you see there, you start seeing a very big challenge. How do you share that information without breaching confidentiality, but at the same time supporting those specific individuals? Geospatial information, movement and communication information, it's very delicate. It's very delicate. So before we make any decision or we decide on an approach to take vis-a-vis this challenge, we have to understand exactly what data we are talking about and what the implications are. Next slide. And who wants what and why? Of course, everyone wants a lot of data. The government, just because you're in government, the government is very broad. There's the health sector, there's the economic sector, there is so many people involved. There is law enforcement that try to enforce, for example, the social distancing measures that are in place. The government is very wide. So it doesn't mean that just because you're in government, you should have access to all the data, including personalized data. The private sector, businesses are very concerned. They are trying to dig into a lot of data. Institutional and private researchers, academics and academic institutions, the international community, the IMF, the World Bank, almost all international institutions are trying to get data from countries, journalists, politicians. We've seen, for example, a lot of, globally, we've seen some news and some stories that are linked with politics, that are linked to personal issues of people. So we have to be very careful, and that depicts the challenge that we have in terms of balancing what can be accessed and not denying those that want to deal with the issue, deal with the issue. Next slide, please. And this is the last slide. So with the two things, the context and who wants what and why, from our perspective, what we are seeing, for example, from Rwanda, is that now it's time to deal with this issue holistically, because this is a problem that has been there and it's increasing and it will only increase. So it only makes sense to try to deal with this challenge in a holistic way. We are working with the Ministry of ICT. In Rwanda, we didn't have a law in place that regulates access and protection to data. We have a very good statistics law, but it has been very conservative and very tight, to the extent that some stakeholders felt that it was very difficult to access data to do analytics that would allow intervening in such a situation. So we are working with the Ministry of Information and Communication Technology, with other stakeholders, to put in place a law that will help us regulate access and data protection and mitigate the challenges that we've been seeing in the existing laws that we have. But our starting point is protecting core principles of privacy and confidentiality. And I put that in brackets, conservatively. So anyone that should expect to have access to data should come from a point of view that we are going to be very conservative in terms of principles of privacy and confidentiality, but also we have to accept times are changing and changing very quickly. And at the same time, we are trying to establish very dynamic ways for facilitating secure, controlled and accountable access to data use, especially using technology. Now, it's possible to share information if you have the right tools and technologies, and to make sure after you've screened who wants what and why, and you think you've vetted them and they can have access to such kind of information, then you're sure and able to share with them the information and have an agreement with them and control and make them accountable on how they are using their data. So that is possible with technology now, and that's what we are trying to put in place to make sure that much as we want to be very conservative in terms of privacy and confidentiality, but we don't suffocate legitimate use of data that can be very useful in situations, for example, like the COVID-19 situation that we're in right now. Thank you very much.
Thank you so much, Yusuf. Before we move on, let me just ask you one follow-up question. And as you've mentioned that Rwanda doesn't yet have a comprehensive data protection regulation. So I'm curious, who is making decisions about what uses of data are acceptable by whom? How are those decisions being made across the government in Rwanda now in the context of COVID-19?
It's very difficult to centralize decisions, especially on who access what data. What we have in a country, we have a task force that is chaired at the highest level, at the Prime Minister's level, that is in charge of mitigating the effects of COVID-19, both in terms of spread, but also economic and social issues. And for example, the National Statistics Office is part of that committee. And for example, another institution that regulates telecommunication companies is also part of that. The central bank is part of that, and so many other institutions are part of that. So when a decision comes of what kind of information we need, it comes down, for example, if that information is needed, for example, from the Statistics Office, which a lot of information has come from Statistics Office so far, we sit down and follow the rules that we have. For example, I just told you we have a very strong statistics law in terms of privacy and confidentiality. And we also have existing mechanisms through which we've been using to share information. So for example, if we think we can do the analysis and not necessarily give you the data, we do the analysis and give you the outcome of the data without necessarily sharing confidential information. And other institutions that are regulators in their respective fields do the same. So I wouldn't say it's centralized. I think there's still some level of disaggregation, decentralization in terms of who shares or who makes what decision to share information. And the opportunity that we have, or the good, I would say, the chance that we have, in Rwanda, the cases are not yet very many. So from the pandemic perspective, we have only around 300 cases, no deaths so far. So we haven't been tested so much in terms of how much we can stretch that problem between sharing data and confidentiality. The biggest challenge is from the economic perspective because of the very strict containment measures that were put in place. So we are seeing more demand in terms of economic information, economic and social information, other than the COVID-19 pandemic side of it. Thank you very much.
Thank you so much, Yusuf. Really rich and interesting experiences from Rwanda. We are going to turn now to an extremely different context, which is the United States. I'm going to introduce Sam Knotson. He is director of the International Statistics Program at the National Center of Health Statistics at the U.S. Centers for Disease Control and Prevention. So Sam, over to you to talk us through how these issues are being grappled with within CDC and in the U.S., please. Sam, if you're talking, we can't hear you yet.
Can you hear me now?
Yes, Sam, welcome. Thank you. Please.
Okay, sorry about that. What I intend to talk about this morning is plans at the U.S. National Center for Health Statistics for data collection on COVID-19, and also to describe the safeguards that we have in place to describe or to ensure data protection. So next slide, please. I'm going to cover our 4 major data systems and the plans in place now for additional questions on COVID-19 or the availability of COVID-19 in each one. At present, the only one of our systems that has COVID-19 data is the vital statistics system, which of course derives from death certificates obtained from U.S. states and registration offices. And thanks to the implementation of electronic death registration in most of the U.S. states, we're now able to receive data much more quickly than in the past. And what this has meant is that on our website, we are able to post weekly preliminary counts of COVID-19 deaths, which are updated regularly. There are inevitable delays in the receipt of death certificates just because of the process, but nonetheless, this procedure now is much faster than in the past. Now, under discussion are plans to add questions to other surveys that are conducted by the National Center for Health Statistics, for example. Well, and I should say that some of them are fairly routine. For example, in the health interview survey, there are plans to include questions on self-reports of COVID status, either doctor diagnosed or test confirmed. The Health and Nutrition Examination Survey, which provides nationally representative health data based on actual physical examinations, is currently not in the field because of COVID-19, but has plans to include self-report questions and lab testing of serum for COVID status next year when they're back in operation. Could you go back to that last slide, please? Thank you. And then finally, there's a family of healthcare surveys that covers a range of healthcare aspects, from ambulatory care survey to hospital care and other aspects of patient care. And there haven't been any final decisions yet on what will be covered, but some of the things that are being considered are the availability of personal protective equipment, the availability of COVID-19 tests, the use of patient referrals, the use of telemedicine to reach patients, and then finally the possibility of inquiring about providers who have tested positive for COVID-19. So those are the current plans. So let's go to the next slide, please. Thank you. Now, in terms of protecting this information, we take this pretty seriously, as you'll see as you go through the list. But we'll start with the legal protections that are out there. There are a number of laws that cover the confidentiality of data that we collect. The first two of the items listed are fairly general, that use will be limited to those specified at the time of collection, and that access to that information will be limited to those specified by the collectors, the interviewers, at the time of collection. The second two are more specific, and the first one of those is that PII, as it's known, personally identifiable information, can be released only to those who've been granted access to that by the respondent. And then finally, that data will be available only for statistical uses. Those laws include a number of fairly severe penalties, up to 5 years in prison, up to $250,000 in fines, loss of job. All of these are there to be imposed on anyone who violates the confidentiality protections. And beyond that, there are a number of other safeguards. There's no off-site access to personally identified information. So for example, despite the fact that our office has been essentially closed for 2.5 months now, the group that you will see in the office are those members of staff whose job includes accessing personally identified information, because they can only do that in our office. That's the only place where we can absolutely ensure that the data will be protected. We don't allow the use of portable media for personally identified information. All of our staff take annual training and sign non-disclosure agreements that lay out the requirements and the penalties contained in these laws. But let me just add that beyond all of this, all of our staff recognize that our surveys, our data are only as good as the confidence that the American people have that their information will be protected and will be put to good use. We recognize that if there are news reports of misuse of the data, this will dramatically affect the response rate, the proportion of respondents who have been selected who agree to participate in surveys, which will affect the quality of our surveys. So we are all focused on this. Next slide, please. There are a couple of ways in which we try to enhance the availability of data while still ensuring confidentiality. And the first of these is what's called the Wonder system, which is available on the CDC website. And for the National Center for Health Statistics, this concerns access to our vital statistics data on births and deaths. Basically, you can use the system to build your own tables. They can be extremely detailed tables, but the system is set up to ensure that you won't be able to identify single individuals, and yet you will have the ability to explore the data yourself. And we find there's an awful lot of use made these days of this system. And secondly, for the what we might call the power users, there's the Research Data Center that provides access to restricted data under very specific conditions. And the first of these is that the user has to prepare a research proposal that's reviewed and approved by the RDC staff. The second is they access the data at the RDC site. And by access, what I mean is they have prepared typically a computer program to analyze the data. They are able to run the program, but what they get to see is not data on the individuals. Instead, what they get to see is the results of the analysis program. On top of that, the results are then reviewed before release. And finally, any manuscript prepared for publication has to be reviewed by staff at the Research Data Center before it can be submitted for publication. So these are a couple of the ways in which, to the extent we can, we make available as much data as possible. Next slide, please. So thank you very much.
Sam, thank you so much for that. I I would love to dig in on some more details there, but in the interest of time, I'm going to save that to the question and answer period and move us along to Alex Pompey. Alex is a research manager on Facebook's Data for Good team. And this is the team at Facebook that's responsible for using Facebook's data to help humanitarian organizations during national disasters or public health crises as we are in now. So we are pivoting from a look of how government agencies are operating right now to an example from the private sector. So Alex, please feel free to let us know how Facebook is contributing to this effort.
Thanks so much, Sarah. Thank you also to the UN Statistical Division for this tremendously timely and important conversation. Also, it's an honor to share this panel with my colleagues Yusuf, Sam, and Jenny. And of course, thank you to all the attendees joining during a difficult time, during challenging hours of the day and night from around the world. Next slide, please. So as Sarah mentioned, Data for Good is a team at Facebook, and it's our job is to find data sets that can be shared with response agencies for public health crises and natural disasters while protecting user privacy. And we've been doing this since 2017, so still a relatively new team at Facebook. Shown here is sort of a menu of the geospatial data sets that we have available. The two categories or families of these geospatial data sets are shown. The publicly available data sets overwhelmingly do not use any Facebook user data. So whenever possible to protect user privacy, we just avoid using our user data. And what's kind of typical here is that we combine very large publicly available data sets like census outputs or large collections of high-resolution satellite imagery. And then we produce novel data products that can be made available with open license, publicly available, and often we open source our code that we use for the generation of these different maps. The other option is that we apply a differential privacy framework so that we can mathematically quantify the explicit re-identification risk and contribution of single individuals to an aggregated geospatial data set. So we would consider that we need the highest level of transparent privacy protections if we were going to make user data available like we do with our movement range and social connectedness index, which I'll talk about more shortly. The category shown on the right in green is available with an additional access protection. So NGOs and academic researchers who comply with a data license agreement access additional data sets that are generated in times of crisis and then are discarded after a set time period once the crisis subsides. Next slide, please. So the first data sets, I'm going to speak about 2 of those 10 that I showed on the menu. The first that I wanted to show you all was our movement range data sets. We released this on April 6th, 2020. So it was developed very rapidly in order to respond to the rapidly evolving COVID-19 crisis. What we are looking at here is the percentage of Facebook mobile app users who have explicitly opted in to sharing their location history data with Facebook and who are present in only a single Bing tile level 16, which is approximately 0.5 kilometers square on a side in Europe. And these are, each day, we take the percentage of those users who are in just a single Bing tile. And you can see here a time lapse. It's a little bit shaky with, but it's an animation. From the beginning of March onward, we see an increase in the number of Facebook users who are staying put, so to say, staying in that single tile, starting in Italy, and then gradually moving in Spain and France, most pronounced. And then a general thawing of this stay put percentage as relaxation measures have come into place. You'll also notice that there's gaps in the data. This is a result of one of our key privacy protections where we drop minimum counts. So any single level 2 administrative unit, the equivalent of county in the United States, if there's below 300 of those location history users, we would not surface that metric. There's the differential privacy noise added to this data set to protect privacy is also one of the key privacy protections. And the full research level description of that differential privacy approach will be available shortly in the next coming week. So next slide, please. The second data set, which we've seen the most efficacy from, is our social connectedness index. What the social connectedness index is if we take, say, all of the counties in the United States, and we add up all of the friendship ties on Facebook between users in a county with all other counties. So let's say San Francisco County in the United States, the county that it has the most total friendship ties with gets a score of 1 billion. And the county in the United States with the least number of total aggregated friendship ties gets a score of 1. And then we fill in all other counties within that with a score, an index between 1 and 1 billion. This is the social connectedness index. And what that essentially creates is a relative probability of social connection or friendship ties between geospatial areas. And what this data has shown, here I'm borrowing a graphic from Johannes Strobel's research out of NYU that found that the social connectedness index data shows areas with stronger social ties to 2 early COVID-19 hotspots, specifically Westchester County in New York and Lodi Province in Italy, where generally have more confirmed COVID-19 cases as of March 30th, 2020. This holds to the relationship of social connectedness index correlates quite strongly with additional areas of COVID-19 cases, even when controlling for the geographic distance between those 2 areas. So this is very interesting. This is a critical covariate for understanding the spread of COVID-19, is that not just proximity or distance, but also the relative weight of social connections has an important predictive capability for how the disease would spread. So all of these data sets rely on pretty classical geospatial privacy protections. You've seen the aggregations here are almost always at admin level 2 or the county equivalent in the US, or making use of Bing tiles. We add noise and do spatial smoothing, usually like an inverse distance nearest neighbor or second nearest neighbor level of smoothing. We drop low counts, like the 300 minimum user count described for the movement range data sets. We apply differential privacy, and soon we'll be publishing the full methodology involved with this approach. And when the data is more sensitive, we only allow controlled access to vetted NGOs and researchers under a data license agreement that clearly states the allowed terms and use cases for our users' geospatial data, even in aggregated form. So yeah, back to you. Thanks so much for the opportunity.
Alex, thank you so much, and really nice job taking through some of the buckets in terms of partnership models and kind of technology solutions to privacy. We do have a question in the chat that is very specific that hopefully you can answer quickly, which is how can researchers access Facebook data generated during this pandemic period, and particularly data at lower geographical levels?
Sure. So the data sets that are publicly available, well, the one-stop shop to find a place to access the data is our website, which is dataforgood.fb.com. or you can connect through the hosts, and to my email, it's just my first name and my surname at fb.com. I'd be happy to assist. The publicly available data sets are generally posted on the UN's Humanitarian Data Exchange, or it's often referred to as HDX.
Okay, excellent. Thank you so much for that. Great. We are going to move over to our final speaker now. Jenny Tennyson is the Vice President and Chief Strategy Advisor at the Open Data Institute. And her institute works with companies and governments to build an open, trustworthy data ecosystem. And this is their tagline, where people can make better decisions with using data and managing any harmful impacts. So Jenny, I'm really hoping that you can give us kind of your big picture perspective from a civil society angle. Some of our other speakers have touched on some of the buckets, the policy and regulatory, the technical solutions, the partnership models. We haven't heard very much about oversight, except for maybe the task force that Yusuf mentioned in Rwanda. So I'm really looking forward to hearing your perspectives on balancing and enhancing data use with data protection. Please, over to you, Jenny.
Thanks, Sarah, and thank you very much for inviting me along to the webinar today. As Sarah introduced, I'm from the Open Data Institute, which is a not-for-profit based in the UK, and we have been working a lot around COVID-19 data, and particularly looking at how to make sure that data that can be useful can be used by everyone. If you put onto the next slide, please. So our vision at ODI is that we want data to work for everyone, and as Sarah said, we really focus on how data can be used to inform people's decisions, while coupling that with needing to protect people from any harmful impacts from that data use. And the diagram here is our kind of theory of change, or data kind of ecosystem map of what we see going on in the data ecosystem, where we see both organizations hoarding data, keeping hold of it and stopping others from using it, and people being very concerned and worried and fearful about the way in which data might be used, misused against them. And we therefore try and work towards more openness with data, and more trust building and more trustworthy uses of data in order to get this best positive impact out of its use. And one thing that I've noticed in the COVID-19 response is that as well as that both of these kind of trends towards data hoarding and data fearing have actually come to the fore, as well as their opposites. So I'm seeing organizations and in fact particularly public health authorities and centralizing bodies actually pulling data into themselves for their own purposes and for their own very vital decision making, but not sharing it back out to the communities or the local authorities or to businesses who could also benefit from that data. And on the flip side, I'm seeing people getting very concerned about how data that is about them might be being misused, particularly when it's being collected through contact tracing apps or symptom tracking apps and so on. So I think, as with anything in the COVID-19 crisis, is really amplifying lots of the stories and the kind of narratives that we see elsewhere. If you could go on to the next slide, please. So I was asked to talk about things that worry me, and I'm going to talk about 3 patterns that I've seen that are worrying me. First of all is organizations seeing data and the narrative that data protection is a barrier. So even the title of this webinar, use versus protection, or implying that there's some kind of trade-off that needs to be made, that we can only get use out of data if we give up some of our rights to privacy. That for me is a very troubling narrative. I don't think it's true. I think that we can, as has been demonstrated with some of the previous talks, that it's very possible to use technological solutions to restrict access in intelligent ways, in order to get good use out of personal data without giving up privacy. And along these lines, I'd really highlight the work that's going on here in the UK by the Open Safely team, led by Ben Goldacre, who are really trying out different kinds of approaches that are much more open while being privacy preserving around access to and doing research on patient data. Second pattern that I've seen that worries me is that very generously and rightly, a lot of private sector organizations that either have data or have skills in using data are collaborating with public bodies in order to help them to respond to the crisis. And that, like I say, I think that that is good. I want the private sector to do their part to help us through. But what I also see is because those organizations are distrusted, that distrust spreads to the public sector organizations. And when that happens, as was mentioned earlier, it means that people might withdraw consent for data use, or they lie when they're responding to a questionnaire, or they choose not to participate at all in data collection activities. And that's particularly troubling when it means that we challenge our actual public health response. So, for example, people not participating in contact tracing or downloading the contact tracing app because they're worried about that data ending up in the hands of private sector organizations that they don't trust. And we're seeing that narrative play out very strongly here in the UK because of the collaboration of the UK NHS with Palantir, which isn't generally a trusted organization. Not to say it's not trustworthy, but just the narrative around it is that it's not trusted. And then the third kind of piece that worries me is the kind of normalization of emergency practices. So currently, I would say that there is an acceptance of a need for a collective response around the pandemic crisis. And that has led us to being more generous with data that is about us and seeing it as acceptable for that data to be collected and used in very flexible ways. But that's highly, we have to recognize that that kind of permission is highly contextual and that it will change over time. And one of the things that worries me is what is the long-term impact of some of the changes that get made now. We've seen previously, for example, laws that are put in place in an emergency situation, granting access to information and granting uses of information, then become the norm, then become written into law longer term. And I think we have to be watchful of that happening. So next slide, please. So the two things that I think I've noticed as being successful patterns and that I think are absolutely required are around openness and transparency and around a flexible, agile, iterative and learning governance style. So just to go into those a little bit, one of the things that breeds distrust in the way in which data gets collected and used is when people are surprised when it emerges through the press that data has been used in a particular way. And preempting that with proactive openness and transparency, I think, is vital for preventing those shocks that then diminish trust in the system, that diminish trust in public authorities. And the other place where I think openness and transparency is really vital is enabling lots of people to benefit from the data that is being collected and used. So as I said, I see this pull towards more centralization of data when actually researchers, local authorities, citizens, CSOs could all benefit from being able to flexibly see what is going on. We're in a situation where certainly in the UK, nothing is as it was before. So everybody needs to learn what the new normal, what the current is, and what the future might be. And data is really an essential part of that. it's not only central government or central health authorities that can really benefit from data, and it's not only health data that is essential in helping give us those insights. The second aspect is about this governance and oversight, and I'm using the term learning governance, which was one coined by Natalie Banner at the organisation Understanding Patient Data as part of the Wellcome Trust in the UK. So this concept is one that we often think that governance has to be set up all in advance, and all of our decisions about what the best trade-offs or balance might be made up front. But actually, in a situation where we have to move quickly, and where we need to adapt over time, then we should think more about governance as an iterative process, one where we start off with a good kind of governance process, some decision-making bodies and so forth, but then after a period of time, say 3 months, the decisions that have been made get scrutinized, get looked at again. The public and patients get involved in re-looking at those decisions, and lessons learned and changes made to the way in which governance happens. And that means that there's that re-looking at what decisions have been made historically at very regular intervals means that people who are making those kinds of decisions know that they're really going to be scrutinized for them, but also it means that our approach to governance can change as our norms change about what's acceptable and what isn't, and as the context changes in terms of the threat from the disease and what kind of access we see as being crucial or not. So for me, then those two parts, in order for getting to making that good balance, I think we just have to stress really, put a lot of effort behind being as open and transparent as possible, and learning from what we hear from people who see that openness and transparency, understand what we're doing, and have objections to it. And we also have to have a formal but iterative approach to the way in which data is governed and the decisions that are made about who gets to access it. That's all I wanted to say. Thank you.
Jenny, thank you so much, particularly for this last point about learning governance and how we'll need to look back on what decisions have been made with data and how data have been used on an ongoing basis. This is, I think we're going to dive into a little bit more in one of the questions that we have coming up. We have about 30 minutes left for questions, and so far, based on questions that we received prior to the webinar and that are coming in now, I'm going to suggest 3 categories of questions. We'll spend 6 or 7 minutes on each, so I'll ask you to be brief. The first bucket of questions is really around the nitty-gritty of data protection and privacy measures. I'll talk through that in a minute. The second question is really around the role of NSOs in all of this. As we can see, there's a lot of different actors involved, so we want to drill down a little bit more, hopefully with your help, especially Yusuf, on what the role of the NSO is in this context. And the third set of questions that we mustn't neglect is builds on what Jenny said, which is how do we ensure that at the end of the crisis, whenever that might be, we are returning back to kind of a normalized use of data that we would consider acceptable in a non-emergency context. So I'm going to start with this first bucket of questions around data protection and privacy measures. There's a lot of curiosity out there about newly adopted methodologies or procedures or laws to protect individual data during a pandemic. So we're curious about what you're doing in your own organizations, or what you're seeing other organizations do, or what you think they should do. And as we have been discussing today, 3 very specific questions have come in that fit in this bucket. One was around, so take notes here, speakers, and I'll just ask you to each take 2 minutes to kind of respond on this bucket. One is really around, are we learning anything about data protection and use in this context that should have implications for the fundamental principles of official statistics? So maybe Yusuf and Sam, you can touch on that if you have thoughts. We've had some questions specifically around data randomization and the role that that plays in protection, and also really about kind of whose eyes are on the analysis that's being conducted. So for example, within your National Center for Health Statistics, SAM, or within Facebook, who is looking at your algorithms, your analysis to make sure that they are unbiased, that they are ensuring confidentiality? So we have a whole bucket of questions about the how of the data protection and privacy. So I think I might go in our original order that we started with, return back to Yusuf to give us 2 minutes on this bucket of questions. So Yusuf, over to you.
Yeah, Sarah, can you hear me?
Yes, we hear you, Yusuf. Thank you.
Yeah, thank you very much. There's a very good question regarding the role of the National Statistics Offices in data sharing, in privacy, and so on and so forth. Of course, the role of the National Statistics Office is changing, but I'm going to give some insights into our context and what makes our role important or not important. For a statistics office to have a significant role, it will depend on, first of all, the reputation of the statistics office in the country. It will also depend on the ability of the statistics office. If the statistics office has good information, then it will have a role. And it also depends on how the statistics office is empowered in the overall structure of managing the country. So in our case, for example, in Rwanda, the statistics law is very good. I would say it's very good. It's very empowering. It gives us access to any information that we want in the whole country. It removes all limitations on confidentiality if we ask for that information. So that puts us in a very strong position to get information. But of course, as the previous speaker said, it also gives us a lot of responsibilities. You can easily go to jail for 5 years or 10 years or even more because of breach of confidentiality. And another thing is, over time, we've built a lot of capacity to be able to first of all, collect information, but also share the analysis and insights into information. And the government respects that, and almost the whole community, the whole statistics and wider community trusts us and empowers us to do that job. Now, you can't do this job alone because some information, other institutions are better placed to provide information. For example, telecom information. There is another regulator on telecoms that has information, but statistics, we can as well access that kind of information. So the role of statistics is very important because the laws that we have in many countries, the statistics laws are very strict vis-a-vis confidentiality, and many statistics offices already have a lot of capacity to process and share information and share insights into the information. So I think depending on what context the statistics offices are in, it's very possible for the statistics office to play a very strong role, and in some cases the statistics officers will not play any role at all if they are not empowered, if they have no good reputation, if they don't have the ability to provide that kind of information. Thank you very much.
Thank you so much, Yusuf, for touching on both the first and the second question, including the role of the NSO. Let me push you a little bit harder on this first bucket of questions around kind of the nuts and bolts of data protection and privacy. I'm wondering if you can talk us through maybe one example of a method or a procedure or something that you have used within NICER that is specific to the pandemic context. Is there a new approach to data privacy and protection that you have been employing in this context? Or is there something new that you're learning in the crisis context that you might apply going forward?
As I said during my presentation, the challenge of access to data and confidentiality and privacy is not new. In fact, we just realized now that we have to be faster in putting in place some measures that we've been trying to put in place, but maybe not as fast as we should. First of all, a good example is when we are asked about information. I'll go to the economic side. When we are asked information about the performance of the economy and industries and specific companies, our starting point, as usual, we are very conservative. We don't give that kind of information, the details. We have to, just like the previous speaker, Sam said, if we really think you have a genuine question, you have to justify. You have to justify and tell us we want this information and specifically for this purpose. And we have to scrutinize if you can't get that analysis of whatever answers you need from information that is already publicly available and is anonymized. Now, if you can't get that information, our starting point is, can we actually do the analysis for you and not give you the data? Now, if we can't do the analysis, then especially if the demand is huge and we don't have the time or we don't have the technical abilities to do that kind of work, then the next step that we need to strengthen going forward is how do we put in place infrastructure that are technologically based, so that some of those requests that are genuine, we can either allow the users to come on premise at our office and only do that specific analysis that they need to do that they can't do from the publicly available data. And when they come to our premises, we make sure we have controls to make sure they don't take anything out that they don't need to take out, or they don't access anything that they don't need to access. Another possibility, as has been mentioned, is to put in place infrastructure so that those users that have been screened, that have legitimate interest in analyzing data that is personal, can also access that kind of information remotely, but there should be a trail of evidence of what has been accessed and how it has been used. And we should also have agreements with those kind of people to make sure that they don't abuse the access that they've been given. So these are the measures that as a statistics office we want to strengthen. And because we have regulatory powers across the system, we don't want to implement those measures only at the statistics office, but also to all other government institutions that hold public data. Thank you very much.
Yeah, so helpful. Thank you so much, Yusuf. Okay, Sam, over to you on this kind of first bucket of questions around data protection and privacy measures. And there was a specific question directed to you on kind of who's reviewing the analysis to ensure confidentiality on the work that you're doing. So please, over to you on this first bucket.
Okay, thank you. Can you hear me?
Yes.
Okay. Yes, well, to respond to the first question, let me just say that this is not the first time that our centers had to deal, well, any of the statistical systems, official statistical organizations from the United States have had to deal with confidentiality and access questions. It happens pretty frequently. And it actually, because of our status as an official statistical organization, a certain data like personally identifiable data are not accessible to anyone. And that goes to the highest levels of the US government. So we have that. And because of this experience over time, we're pretty confident that the system that we have in place for safeguarding data confidentiality and protecting personally identified information is sufficient to take care of the needs under COVID-19. We shall see, but thus far, I think we're very confident in that. Now, in terms of who is analyzing the data, here again, let me explain a little bit about an official statistical agency. Our focus is in putting out the information, getting it out and accessible or basic analysis as quickly as possible. We're not allowed to discuss policy as part of anything that we produce, sometimes much to our frustration, but those are the rules. And so there the goal is to put data out there for others to analyze. But in terms of what we analyze, there's a whole internal process for reviewing the work that's done within the, let's say, the specific survey, and then at the level of the center with a science officer who looks at the approach taken, the validity of the methods used, and so on. And so again, we're pretty confident in that, as well as ensuring that the analysis that's done is done by the right people and it's done appropriately. Back to you.
Thank you so much, Sam. There's a lot of questions right now around contact tracing coming in through the chat. Is there anything that you would say, Sam, about how the CDC or your institute or the U.S. more broadly is thinking about contact tracing? Is that something you can speak to? Contact tracing is not something that we do at the National Center for Health Statistics, and I really can't comment on what's being done elsewhere within CDC or elsewhere within government. Okay, we'll come back to that topic later then. Thank you, Sam. All right, Alex, over to you on this bucket of questions around kind of the practicalities of data protection and privacy. And particularly, I'd love for you to touch on this question of who is reviewing your analysis. Is there peer review or external oversight on some of the algorithms that you're applying or the analysis that you're doing to ensure confidentiality, lack of bias, and just sort of overall compliance with ethics? So how does that work at Facebook?
Sure. Thank you so much for the question. I think there's kind of two broad categories here of validation that would be required for any scientific conclusion. The first would be a validation of efficacy. To mirror some of Jenny's language and like some concerns, I think a lot of Silicon Valley efforts that might arise out of, let's say, a rush or a push to move quickly, which is classic of the industry, come from people without the necessary domain expertise to be making any sort of correlation to efficacy outcomes in a public health domain. So what we really do to mitigate that, acknowledging that we are not the experts in this space, is relying on, Sarah, your third level of action, which is a partnership model. For COVID, that's always been data for goods model for our disaster response product development. And for COVID-19 specifically, we've worked very closely with a group led by Direct Relief and Harvard University called the COVID-19 Mobility Data Network. I'll drop the link to their network's website in our chat. And so they have really helped us understand and identify those critical information gaps where Facebook is uniquely positioned to offer value and really demonstrate that efficacy. And then when that efficacy can be achieved with our highest standard of privacy protections, that's when we invest in applying the differential privacy framework to make those data sets even more widely and publicly available. So that leads to the second category of validation and transparency required, which is validating those privacy protections. And with the increase of consumption of Facebook's data for good products, we've had to likewise increase the amount of dialogue and engagement with the civil society organizations in the data privacy community, ODI and others, to really be as transparent about our privacy protections, our data governance models as possible. Typical for us is that we we're really excited and quick to build data products, but then the time to publish on things like the privacy methodology, it takes time to put through peer-reviewed journals. And so in the meantime, that dialogue is what we rely on. What I'd specifically point to is an op-ed in Science, which came out at the beginning of April by Caroline Bucky and signed on by around 25 other leading epidemiologists, who specifically called on the role of epidemiologists in the private sector to rely on aggregated data first and exhaust efficacy there when it comes to location data, before moving on to perhaps more silver bullet-esque ideas around disaggregated or contact tracing data. And so we really kind of followed the approach put forth in that op-ed. Thanks so much.
Great. And Alex, if you don't mind, I'm going to put you on the spot a little bit, building on a comment that Jenny made about, when not very trusted organizations or companies partner with governments, and then that can jeopardize the trust in an overall public health approach. There's no mystery or surprise that Facebook has been on a bit of a roller coaster in terms of trust. The Data for Good team, of course, is a specific team within Facebook. But I'm curious if there are examples of partnerships that you simply say no to or just don't do because of issues around trust or reputation, or how Facebook might impact a partnership with a public sector organization. Is there anything that you have to say on that?
Sure. So I'd say the saying no happens on both sides of an approach. There's many NGOs, researchers who would say no to partnering with Facebook, and we completely respect that. For Facebook, on the Data for Good side, our model has always been to empower the work of the NGOs, civil society, and research institutions, rather than engaging with ministries and governments directly. Basically because of a limit to scale. So establishing data license agreements with governments, even under the cleanest of data privacy circumstances, still takes very, very long time just from a legal perspective. And so we'd rather invest that energy into increasing the privacy protections, the transparency, the dialogue to validate that I discussed in my previous response, and make those data sets fully publicly available to health ministries, NSOs, everyone involved. So that's sort of been our approach to date, and we haven't really exhausted the limits of efficacy on that. So to be clear, Data for Good, we don't engage directly with health government ministries of any kind. We make certain data sets available to NGOs and researchers under data license agreements, and we make other data sets available fully publicly.
Okay, thanks so much for that. Okay, Jenny, I'm going to come to you next, and on the kind of this nuts and bolts question, but there was also a provocative question that came in from the chat just now that said, is privacy more important than saving lives? And of course, I think you would argue that, in fact, it's not an either or, but those are sort of or mutually enforcing principles. And the same questioner asked, isn't there a global organization that can help us navigate this? So I'm curious from your perspective, not only on these nuts and bolts pieces of the question, but on kind of the global governance elements of these questions. What do you see from a civil society perspective?
Yeah, so you're completely right that I think that it isn't an either or in terms of saving lives or preserving privacy, and I think that we do badly when we neglect to see some of the poor impacts that can come from when privacy isn't preserved. So, I've been looking over at the kind of data publication from South Korea that seems to be then leading towards towards homophobia because of a particular case in some gay nightclubs and the spreading of COVID-19 through one particular person visiting a bunch of them. So we have to be, I think, mindful that harms come to us apart from through health. And that I think, picking up on what Alex was saying, it's very possible to do a lot without having to go into undermining people's privacy. So why don't we try that first, rather than jumping to needing to have all of the data about everyone in order to try and combat it. So I think we sometimes get over enthusiastic about data. Certainly I do, about getting hold of lots of data, when actually we can achieve the same or almost the same results without having that level of detail. The bit that I wanted to the bit I wanted to pick up on the nitty-gritty question was, of course, to offer the the open model for providing scrutiny. So if you look at Open Safely, then they have a very open model where they publish the actual analytics code that they use behind the papers, so you can see it, you can build off it, you can critique it, you can offer fixes to it, and it's that kind of model that we need. I also recognize, though, that you only get that kind of model working where you have an effectively capable set of people that will do that scrutiny. But I think in a place where we have a large collective response to this crisis, we have enough eyes to have some of those open models really work to provide that level of scrutiny that's needed over these kinds of analytical approaches. And as for that kind of question about international governance, I think that's a really tough one. To my mind, then organizations like the World Health Organization should be providing guidance around the way in which health data in particular is being used during the crisis, and to the use of other data which is being used to address pandemic issues. And for me, then it's organizations like the UN and others that can provide guidance around proper use of data in these kinds of contexts, and should be and are, from what I can see. I think we have to also recognize, though, that there are different contexts in different countries, different norms, different pieces that are acceptable, different ways of viewing privacy, and we shouldn't get too tied up with needing to have one consistent way in which this is addressed across the entirety of the world. It helps when there's some of the same approaches are used, because we can learn from each other, but it also helps to have some different approaches tried and used and tested, so that we can see pros and cons for those different approaches, learn from each other, but also because in different contexts we have different kinds of norms and things that are acceptable. For me, then being able to engage with the people who are being affected directly by the way in which data is used is how we should judge whether or not something is acceptable.
Thanks, Jenny. And I'm going to stick with you, and we're going to go back in reverse order for a quick round of closing remarks. And in these closing remarks, I would love to hear from you each a response in our kind of third bucket of questions, which is, what do we need to do now to ensure that as the crisis wanes, which we all hope it does, we are returning to or maintaining kind of the right balance between protection and use, and we don't lock in any kind of overreach or over-invasive uses of data. So what do we do now to ensure that we are returning to quote unquote normal in our data use and protection after the crisis? And I'm prompted a bit by an interesting thing that came in the chat about the Dutch government has just today submitted an emergency law to Parliament enabling the Dutch Stats Office to use mobile phone signaling data on a daily basis, frequency, hourly, and looking at the municipal level to understand population whereabouts. So maybe justified and important right now, but is there a sunset clause on that kind of thing? So each of you kind of close by walking us through preparing for the end of the pandemic in terms of how we use data. So Jenny, back to you for 1 minute, and we'll walk back through in opposite order.
Okay, so for me, then there is a couple of things to realize about the end of the pandemic. One is that we are not going to be going back to what things looked like before. And the second is that it isn't going to be a hard stop. And for those two reasons, that's why I, in my talk, spoke about this idea of learning governance, or this iterative approach to governance that enables us to re-examine at regular and fairly frequent intervals the way in which data is being collected and used and shared. And for me, then building in that approach, a commitment to re-examine, and to re-examine with voices from across the community, that is what will get us to a good place at the end. I know that there are lots of things about sunset clauses and having data being stopped after 5 years. I don't think that we should commit to that now, because we don't know what life will be like afterwards. But I think that by building in a methodology that enables us to reconsider at frequent, regular intervals with a lot of voices, those are the mechanisms that will get us to a good place.
Awesome, awesome wrap up, Jenny. Thank you so much. Alex.
Yeah, I would say that the main consideration that I would take is that we really need to hold ourselves to a higher standard of efficacy. I think it's very instinctual to try and, for an unprecedented level of crisis, to think that an unprecedented level of data or new sources of data are the paths away from that. But so far, borne out in, at least from my perspective, is that very traditional methods are the only things that have shown any efficacy. And so let's exhaust what we have and what we trust before we begin getting carried away and setting new precedents that, as Jenny mentioned, these are very difficult to roll back. Even as the efficacy in diminishing caseloads or diminishing fatalities, this will take years before we have fully peer-reviewed, vetted, large-scale validation. And even the amount of time between that and now, these precedents are quite dangerous. So I think we all owe it to ourselves as the data professionals to institute, just as the crisis level is unprecedented, an unprecedented level of efficacy threshold before we set new standards in our own behavior and ethics.
Okay, Alex, that's particularly meaningful coming from you at Facebook. So thank you for those words. Sam.
Yes. Hello. Can you hear me?
Yes. Go ahead.
Okay. I'd also like to thank Alex, because I think he's reflecting exactly the attitude we have. Currently, really, we have not changed any of our procedures for collection, analysis, publication, availability of data. I don't expect that we will, but it's nice to hear that the private sector joins us in being conservative about this. So thank you.
Thanks, Sam. And over to you, Yusuf.
Thank you very much. I think the most important issue is awareness. Many politicians, many decision makers, I think they need to be on a continuous basis informed and educated that actually sometimes, most times, we don't need the details that are personal to come up with good programs and decisions to address almost anything. So our efforts should mainly be into making all our stakeholders aware of that, and making sure that, or trying to make sure that these invasive measures don't happen to begin with. For example, in our statistics office, actually we've not changed anything from how we've been working before. So if it's possible not to introduce these measures, I think it's even better. Thank you very much.
Okay, brilliant wrap up by all of you, really emphasizing this point that data protection and data use are, one, not in conflict, two, not a new problem, not a new issue, and three, that a lot of the challenges that we're facing now can be solved with reliance on traditional methods, traditional protections, and that we should, in Alex's word, exhaust our traditional methods before getting carried away with new approaches. This has been a very enlightening conversation, and I am particularly taken with this notion of learning governance. We will not have a single moment in time when we return to normal as we knew it. And so this iterative, regular examination of how data are used is a really critical part moving forward. I think the UN Data Forum and this amazing community will help us continue this conversation. Please continue to follow the UN Data Forum and future webinars on Twitter and online. And a huge thanks to the 4 of you for bringing your brilliance to this conversation, and for the UN Stats Division for convening us. Thank you, everyone. Have a fantastic day, and I'm very enthusiastic and enlivened by the learning going on in this conversation. So thanks, everyone, for participating.